Okay, let's continue, yeah? Techniques of logotherapy. Okay, how do you think how it may work? So in general, logotherapy, this is procedure to find a meaning, to help a person to find a meaning, yeah? A meaning, I don't know, for life, for suffering, for being a person, human, and etc. Just meaning, yeah? This is actually one of the techniques, yeah, to find this meaning. But how do you think in this logotherapy, what does it mean, the reflection? If you are telling that, if to give direct translation of this word, that means отклонение. How do you think it may work? We can consider the same example, or give me your own example, and we will try to find out how it may work in this situation. And just let's I don't know, let's imagine that we will be practitioners, and some will come to us complaining on aggression. I need more details. Okay, he's complaining on aggression, that what?
Во всем видит угрозу, может быть, и агрессивно реагирует на некоторые вещи, которые можно было бы не так агрессивно реагировать. То есть угрозы нет, но он пытается защитить себя посредством агрессии. К примеру, слишком обидчивость.
No, we have to, just it's really difficult, yeah, when you invent the situation, maybe in your life. Okay, let's take an example from your life when you were suffering. Let's, when you suffered, not like, oh, I suffer, but maybe you were in trouble or felt uncomfortable, or I don't know, some feelings you had, maybe not you, maybe some of your friends or people you know, because it's very difficult, yeah, when we try to imagine, but just let's try to find a real experience, just an example of, I don't know, suffering. If you understand, the question.
Вот у меня, например, братик, у него очень сильная агрессия, когда он играет в компьютерные игры. У него что-то не получилось, он готов ноутбук разломать, если что, и в этот момент успокойся, скажешь, он на тебя ругаться начинает.
So how do you think, it can the reflection be working in this situation if he would be your client and he is complaining to you on this, that people are not allowing him to play computer games, and as protection he is using this aggression? How you would work with him as, I don't know, therapist, as a counselor? And try. It's not how, I'm just trying to tell you that try to guess how the reflection will be in this situation using as a technique, because it's has the idea of to show different area. I just will explain what does it mean. The reflection, that means if, for example, I'm suffering and I'm too concentrated on this pain I have, but the reflection consists that I had to switch the attention from this pain to another thing, just not to paying attention on this, oh, I'm suffering, I'm dying, oh, I feel bad, and all these things. But this technique consists of idea that I have to kind of be attentive not to this pain, but to another things. Understand? Yes, to give another direction to my attention, not to this, I don't know, if I broke my, for example, arm, and I go and touch everything, oh, my arm is kind of in pain, oh, my arm is in pain, oh, I feel pain, I'm suffering the whole month, or, okay, just I have this, suffering, but don't touch kind of many things with this hand, just give some calmness to your hand and be concentrated that you have right hand, legs, and other things that you have to do. Understand? So this is like,
Трансформация гнева во что-то там, какую-то энергию, это про это?
No, it's not like that. It's just exactly about problem. I'm telling about problem because aggression and anger, this is emotion, this is feeling. It's not it can be a problem for someone, but it's the example I'm trying to give you where this technique is working. It's not a feeling of anger or a feeling of aggression, but I have a problem and I have to switch attention to another thing, but not only on problem. Understand? Because if, for example, I feel aggressive and I make a view that I don't feel this aggression, anyway I will kill someone, I mean, not in direct way, because anyway I will show this aggression. So in that sense, it may not help to make the reflection from my aggression to another things. I have to react aggression anyway, but react in proper way. You understand, yeah? So this technique doesn't work with many things. It doesn't mean that in this situation it will work and this not. But in general, if to kind of consider this technique of logotherapy, yeah, we try to kind of pay attention of my client or my patient to another thing, but not only on suffering, yeah? For example, I have patients who suffer from co-addiction, yeah? So these parents of addictive person, and when they try, for example, to tell me such things, oh, my son, he has troubles, he uses drugs for 10 years, we all troubled in these things, and the story of our life and all our family only around him. Okay, do you have, for example, another children? Sometimes they even forget about another children, and they're so concentrated on their suffering connected with this person that they literally forget about education of other children. Understand? Because they're still kind of concentrated on the suffering. Oh, I'm suffering. Understand? And the reflection will work if I try to pay attention on the other side of their life, not only on this person who suffers or these parents who are suffering. Of course, it's painful, but anyway, there are, for example, in this family system, other people than only this one. Understand? Is it clear with this, the reflection? Okay, meaning, I think we already find a meaning, yeah? Certain meaning we already try to describe, yeah, the things, and we understand what does it mean. How to find meaning, it's really difficult. I mean, how to say, it's not like special procedure, it depends on personality of person who does it, yeah? So, because Frankl was really well educated and his personality all to do this, and he was using, you know, Socratic dialogue. This is the way how we in dialogue with another person, and with our questions we show him some kind of ideas, or I don't know, that he doesn't see. Yeah, this you understand? I'm telling you in general because I can't give you example. It's maybe if you read his books, he is kind of describing the things in this book in more detail. But one of the examples I gave you, yeah, with this doctor who came to him, actually he asked this question: what would it be if, for example, you would die first? Yes, understand? This one is the most known method, and it is used in many other directions too. This is like an invention of Viktor Frankl. Paradoxical intention. On Russian language, they don't do it. They don't give translation. I mean, they call it method paradoxальной интенции. So it's exactly like in English, paradoxical intention. Do you understand the sense of the word paradoxical? What does it mean? Do you understand the meaning of this word? Paradoxical. Yeah, intention, do you understand? Yeah, this, okay. So this method Frankl was using with his patient who suffered from different diagnoses and from neurosis, but mostly he was using these things for treating the anxiety. You were telling, yeah, these things that we can use this method for treating the anxiety. That's true. For example, he was using this method with his patients that were not able to sleep. So he was working in the hospital, and okay, have any one of you suffered from insomnia in your life? Did you have such trouble with sleeping? So you know, yeah, what does it mean? So when you can't sleep, yeah, you know by your own experience, when you can't sleep, what do you usually do? Okay, but it helps you. Не помогает. Yeah, so yeah, because if it's a symptom, if it's really insomnia, it won't help. Okay, what helps you? You just don't sleep. And usually it lasts for how many days? Or just once? Okay. Does anyone know what does it mean if I can't sleep and I won't sleep? It's not like, oh, I just will be looking at my mobile and anyway I will sleep. It's not like that. You will be sleeping, but if it's like that, it's a little bit different. Does anyone understand the situation? It's a little bit different, okay, but just imagine, yes, such a situation that you have such a symptom that you can't sleep, literally can't sleep. And the usual problem of such people that, okay, I go to bed and I'm trying to fall asleep, but I can't. What I'm usually doing, okay, I'm trying to take my phone and, for example, start reading. It doesn't help, of course, because my attention becomes more kind of concentrated. Yeah, I become more tense, and as a result, of course, I can't sleep. Or if I, for example, don't use my mobile, I just lie in the bed and trying to sleep, and more I'm trying to sleep, more I can't sleep because I become more anxious, more nervous. Oh, I have to wake up tomorrow. I have exam. I have to kind of be in a good shape, but I can't sleep, and blah blah blah, and all this. And it's, my level of anxiety is increasing, my level of internal tense is increasing, and as a result, I can't sleep. You understand, yeah, this idea? It's a symptom that often kind of happens in people's life. But anyway, what did Frankl do in the hospital where they did some treatment for people who were suffered from insomnia? Actually, they were suffering from different diagnoses, but they just used this method. For example, when they were trying to kind of put their patients into the position to sleep. Do you understand? Yeah, this is what paradox. Okay, how it works. Usually, if we do like I did right now, yeah, like when we are trying to concentrate, I want to sleep, I can't sleep, I become more nervous, more anxious because I can't sleep, and as a result, I can't sleep at all, yeah. But if I'm stopping to resist, it will be working in different ways. So what did they do? These patients, when they had to go to bed, the doctors came into their rooms and they were telling, don't sleep, you don't have to sleep at all, so you have to stay awake the whole night, so please be attentive, don't sleep today at night, I mean not today, don't sleep at night tonight, yeah, understand? And it works, of course it works, yes, because I have another intention. I have the intention not to sleep, but it's kind of usual biological thing that I need sleeping. And as a result, if I'm trying not to kind of sleep, I'm kind of telling myself I don't have to sleep. As opposite result, I will be sleeping. Understand? This is paradoxical intention. Намерение, да, наоборот, мы меняем намерение. So we are changing this intention to paradox. So we are not telling, oh, please kind of be more attentive to your sleep, you should sleep. No, if I will be telling you like that, you kind of won't be sleeping. Understand the sense? Yes, it's kind of similar. So he invented this method because it works like that. But of course, there is here idea of unconscious. Of course, we can understand this idea of unconscious because we, in that sense, we can kind of use a psychodynamic approach. Yeah, because I tell you the idea don't do, but anyway, you understand this idea as do. Yeah, please do. Okay, understand the other things. But if to give you an answer on the question when you have insomnia, usually people have such things. Don't try to, if you, for example, feel already that you can't sleep, don't stay in bed. Just it's better to kind of stand and do normal things that you usually do, because bed has to be only for sleeping. So don't try to look at your phone, don't try to search in kind of web and all these things. Just if you can't sleep, just I mean stand, go to your table, what you usually do, and do these things, and then you will be able to sleep. Because more you resist, you kind of suffer from the things. Understand? Another example. Yeah, another example he usually gives with. In his books, yeah, and he was given this example when he was on this lecture in Moscow State University. He had a patient who she was suffering from obsessive compulsive disorder. Yes, you know what is it, yeah, that. And when he was in her room with other patients, so she had this kind of disease where she was really afraid of different, you know, микробы, как будет. Как называется? Bacteria, yeah, bacteria. So she was afraid of these bacteria. And maybe you know, yes, such type of personality when people are too kind of careful, they're really afraid of these bacteria and all these things. I mean, it can be part of personality, but with this lady, it became a disease. Yeah, so she was suffering from this disease. And how do you think in this way, if you already understood, yeah, this paradoxical intention, how would it be work with such person who has these problems, I mean, who suffers from this obsessive compulsive disorder, and she's kind of really afraid of this bacteria? What did Frankl do with her when he was in this room where she was in hospital? Yeah, what did he tell her? How he behaved? We keep in mind, yeah, paradoxical intention. So of course she is afraid of. You came into this room, you must be full of this bacteria, don't come to me. Just try to guess, yeah, try to guess. You have this idea, yeah, try to guess. What to do with such person if we want to use this method of paradoxical intention? Как? So how I can? Yes, he was telling. Yes, he was telling. Oh, look, kind of around here. He was taking this, как называется, тряпка, половая тряпка. Clothes. He was taking this clothes and he was trying to wash the floor, and he was telling, oh, look, I washed the floor, but this bacteria, all of them, oh, don't let them die. So there's so many bacteria here, they're everywhere. Just let them be. Understand, yeah, this idea. So it's opposite things. So when he was not telling, oh, please kind of wash everything and wash your hands 1,000 times, you should be careful and all this, because it's kind of more complicated. It will increase my symptom. Understand? Because I'm kind of in resistance. So this is resistance. This is how our psychic works. This belongs to Freud. We remember these things, yeah, that we are kind of resist if we don't like something. But in that sense, it goes in a little bit different way. I don't resist. I just accept and use opposite things, opposite intention, paradoxical intention. So I'm kind of putting a person into position to love these things that I'm afraid of. Understand? And usually it is working with such people. I remember one of my teachers who was a psychiatrist here in Kyrgyzstan. She was really famous, but she died several years ago. Her name is Alftina Fedorovna Zilonkina. I don't know, maybe you even haven't heard her name. She was a psychiatrist, and she was telling when she was working here in our mental hospital in 16 or 70s, yeah, in 70s, because Frankl was not kind of how to say, was not known in Soviet Union, yeah. So in 60s or 70s, it's like he was famous, but not everyone could get to the Soviet Union because we had our own professors, teachers, and it was forbidden to know about kind of Western approach. And she was telling that one of the doctors here in Kyrgyzstan, actually, he was reading Frankl by himself, and he was trying to use this paradoxical intention himself. So he had a patient who was suffering from this phobia of sharp objects. Igla, needle, yeah. So he was afraid of needles. And how do you think what he did with the patients to treat him? How he used this? Yes. He was not. I mean, not like he's hurting him, but he was putting needles into the clothes, and he was showing that he should wear these needles on his clothes. So he was trying to show him that just to be, not to resist, because more you resist, more trouble you have. Understand these things? But yeah, here is the reflection, and here it's another thing that usually uses in existential analysis when they work with anxiety, because it's a problem with anxiety. I am asking a person, yeah, what will be if you won't knock? And so I'm going together with the person till the end, till the end of this fear. What will be, and together I'm kind of just imagine, yeah, what, and it's kind of another idea. Understand? Yeah. Yes. Did I answer? Okay. And any questions? Because I want to continue with Langle, but anyway, it's continuation because he was his student. I want to give you some small continuation because you have seen actually him in video, and he was telling the main concept of his existential analysis. But if you have some question about Frankl, ask about logotherapy, and then I will tell about a little bit about Alfried Langle. Logotherapy, did you get it? It's a really good method, and you see different patients. He was working with patients that suffers from different neuroses. Yeah, remember Freud, hysteria. Remember Jung, schizophrenia. Sullivan, as I can remember also, yeah, schizophrenia. But here it's another type of diagnosis. Yes. Everything clear here? Okay, can I clean? Okay, Langle, Alfried Langle. What did you understand from the video? What things you remember? What you paid attention? Because he was telling his theory in this video.
Экзистенциального быть самим собой.
Yes. Yeah. Yes, actually, this is the main idea of existential approach and the existential philosophy. You're right in that sense. It's just I have to be really myself, yeah, and he is describing the things very kind of good and in very, simple and, in very, I don't know if I can tell like that, simple, and it's like life. When he is telling you, really kind of listen, yeah, to him. Yeah, that's true. I have to kind of have this inner consent to myself. Yeah, I have to have inner consent to anything I do. And if I feel, for example, this consent, do you understand? Yeah, this word consent. Согласие. No. So if I have this inner consent to what I do, for example, here, yeah, we are kind of sitting on this lesson and we are listening the lecture, yeah, and if you have this inner consent to be here on your own, yeah, not because you were made, yeah, to become here, and if you have this inner consent, for example, that you are here and you are listening, yeah, these things I'm telling you about, you are kind of not losing a lot of energy because it's not a pressure. This is choice. In that sense, you are more free, yeah, and it's like not so tense because he was telling that if, for example, you have many sins that you are not agree with and that you don't have inner consent, yeah, you can suffer from depression. That's a sin when people suffer, yeah, from this depression, when I don't have this inner consent to my life, to what I do, yeah, to who I am. The main sin also in his theory, it's about internal dialogue. So he is telling that the only person that I will be the whole of my life is I am. It's not only he, actually, it's existential approach, yeah, they kind of put kind of an accent on this sense that you have to be in a dialogue with yourself, not to push yourself, yeah, not to tell yourself and give yourself orders, but to be in dialogue yourself. And in existential analysis, so he called his method as existential analysis, not logotherapy, yeah, because Viktor Frankl was using the term existential analysis, but he kind of was fond of logotherapy, and that was one of the reasons why they broke up. They actually had some fights. So Alfried Langle was dropped out from this logotherapeutic society from Austria because he was kind of telling about existential analysis but not logotherapy. And the story says that not Frankl who was kind of dropped him away, but the society, because Frankl was not the only one who took this decision. But in that sense, when he left, he found his own direction. He called it as existential analysis, and he said that we have, you know, three basic activities. Yeah, so it's like openness, positioning, and commitment. So this sense about, actually, it's not only about existential analysis. He is describing this sense when he is telling about existential therapy, yeah, and existential direction. But anyway, so in this world where I am, yeah, I kind of have these three basic activities. So I am open, yeah, I have this ability to be open to anything, to any changes. I can change, yeah, and this is openness to I don't know, opinion, to people, to my feelings. Understand? We have this ability. Do you understand about openness? Yeah. Did you get it? Who understood? Openness, открытость. Yes, yes. So I have this ability. Yes. It's not like, yeah. It's like in my human nature I have it, but it's another thing that I don't do it. Yeah, but it's in my nature to have this openness. Positioning, yeah, so I can put myself in a position towards you, towards life, yeah, understand, yeah, these things. So I can be positioning myself, oh, I'm kind of a loser, or I can position myself, oh, I'm the winner, understand? So it's this position into life can help me, yeah. And commitment, you understand, is of course kind of connected with other people and with myself. It's like I do this commitment to myself, and then I feel kind of more, yeah, this world, myself. It's another, yeah, it's another kind of another path, yeah, that he is trying to describe in human beings. How do you think it can help you in? Okay, let's imagine and let's talk that you will be anyway a therapist or counselor, yeah? How it may help you as counselors. Do you understand about this, things that kind of main one in our being in the world, yes? Understand these things? I mean, what does it mean? What kind of this word, and this word mean, yes? Can I, does anyone understand about this positioning? Of course, there are thousands, millions, any other position. Now I'm kind of, It's millions, yeah, in any situation. For example, you are telling about your brother who was kind of putting aggression on you when you don't allow him to kind of play computer games. Okay, you're in position, you are in position to him. You can be in position of sister. You can be in position of replying, of not replying. You can be in position, okay, I will be kind of giving you your time, or I will be in position of putting my another kind of words that all don't play and understand. So this is how our life is structured and built. So we position ourselves always, and in therapy we usually do this reposition. Because if I used to, for example, be I'm kind of victim in any situation. Of course, if you will be victim in any situation, you will be victim in any situation. Yeah, but maybe in some therapies we can kind of change this position. Okay, let's go further. This another thing I will tell you about 4 dimensions of existence, and I think it's enough. Yeah. Are you able to understand these things yet? Do you understand the word existence, by the way? Because existence, this is a part of the word existential psychology, existential therapy. How do you understand the word existent?
To be.
To be. So how do you understand your own existence, that you have existence? Hmm?
That we have responsibility for our lives.
Responsible, that you exist. How you understand that you exist? Huh? That was René Descartes, yeah, who was telling, I'm thinking that I'm existing, but the existential approach, it gives opposite things. If I'm existing, I'm thinking. So it's just a trick. I mean, you don't have to answer on this question, philosophical question, that how do you understand that you exist? You just have to understand that in this approach, they put attention and they understand our human being from the point of view of our existence. So how to be, how to live my life. Yes, understand? And in that sense, we have this 4 dimension of our existence. Yeah, the world. So I live in the world. I live in the reality, and indefinite reality. So I live in this country. Yeah, so that is why reality here like that. If I would, for example, be living in another place, the reality would be a little bit different. Yes, understand? So this is one of the dimension of our existence. Understand? Yeah, the dimension. The second dimension. This is life. This is our life. This is our personal life, because each of us, we have born in a definite date, in definite place. Yeah, we kind of now in different age. We will die. Every one of us will die, and our life is our life. It's not yours life and yours life. It's your life and my life. Yes, understand these things. The wider context — это более широкий контекст. Third one, yeah, being myself. This is not only to exist, actually, to feel this full existence. It's also not only being in the world, being in the life, but also I have to be myself. Yeah, me as a person, like Alfried Langle said. So I have to build really good relationship with myself. As I told before, yeah, I have to have this inner consent to what I do, what I want to do, where I am, and all these things, yeah. So I have to feel really that me is me. And the fourth one is the wider context. How do you think wider context, what he meant? So here the world reality, the life, my life, when I born, grow up, when I die maybe, being myself is really who me as a person, and the wider context. How do you think, what he includes here in this dimension? Here reality, here my life, here me as a person, here. Give me example, what can be? What? No, here. Here this. No. Here, wider context, what did I forget? Me, my life, the world. Huh? So you live alone. Do you live alone?
No.
So this is family, this is cities, this is your friends and all other people. Yes, it's like surrounding, yes, scenes. It's like people and all these scenes. Understand? So it's like how our existence looking like. So you have to understand this is my kind of existence, yeah, this is my dimension of existence. And if to give if to do this existential analysis, for example, I'm asking a person, yeah, what do I need, yeah, for example, am I happy or not happy, yeah, if I'm not happy, why I'm not happy, yeah, if I feel myself like my true, yeah, I'm true myself, yeah, it's like I behave myself like I decided, yeah, to behave myself. Understand the sense? And usually in this approach, they work with another person like that. So it's like if someone asks me for help, and if I'm existential analyst, I'm trying to help a person, yeah, to find an answer on all these questions. Or if you suffer from different symptoms, symptoms are helping you actually. They're helping you to live and to be yourself. And so with the help of this existential analysis, I help you, yeah, to feel yourself more alive in that sense. And for example, if to use the words of Viktor Frankl, is to find meaning, yeah. With Alfried Langle, it's a little bit different. Yeah, it's to live in a consent. Yeah, to say yes what I do, to say yes to reality, to feel myself, and all these things. Understand? So it's more difficult, yeah, for you than this psychoanalytical, yeah, theories. It's I'm telling you about Viktor Frankl and Alfried Langle. So this is not only two persons who are representatives of this approach. So this is Vienna School of Psychotherapy. This is actually third school of psychotherapy, as they call it, because it's has a really strong influence in Europe. I mean, Frankl, yeah, he was the third school, they called it like third school of третья волна, как-то они называли, третья волна психотерапии, the third wave of psychotherapy, Viktor Frankl school. But for example, there are many people who are representatives of this existential approach. Now is Amy van Dortsen also, now is Ernesto Spinelli. Here we have sometimes coming Rimantas Kačiūnas, this is representative of existential school. He has own school in Lithuania, so if you want, you can see him in June. He will do group therapy, so I often invite him to Kyrgyzstan. So there are many things. For me, he is more belongs to American school of this existential approach. I don't like it. My personal opinion, I don't like him. I mean, he is good. He describes really good books, and he didn't invent kind of something new, but he described really good all these philosophical things. So you can read him. Actually, you can read him. But my personal kind of opinion, I don't like him. So. No, I don't like him. For example, I like Erik Erikson, he's American. I like Nancy McWilliams, she's American. Yeah, she's American psychoanalytic. But I don't like how, for example, Irvin Yalom is writing. So it's not close to me. It doesn't mean he's not right, but it's not. I'm more like kind of philosophical things. He is describing very simple. So for you it will be easier. But for me, for example, I like different type of text. So that's only the thing. So.